I'm an eye doctor, and just like everybody else, I have eyes and I have certain problems with those eyes. Specifically, I have dealt with dry eyes for over a decade. I wanted to share my personal story about dry eye and my treatment journey, and at the end of the video, I'll go over my holy grail eye drop and why I think it's working so well for me. Ophthalmologist or not, we are all so similar, and dry eye can really affect anybody, from me to the people on YouTube who are searching for videos on how to best treat dry eye, and even to my patients who come to see me, sit in the exam chair facing me, and recount years of prior treatment with multiple past doctors, but that they feel hopeless because nothing really has worked to fully alleviate their symptoms. So I'm here to tell you that I feel you. I feel your pain, and dry eye sucks because it can really touch every facet of your life. I'm so grateful that I found a treatment that really works for me, and I truly wish that I can help anybody else find a treatment that works so well for them to get them relief of their dry eye symptoms. Hi, I'm Dr. Roxanne Lee. I'm a board-certified comprehensive ophthalmologist and a cataract and refractive surgeon. I hope to open your eyes, pun intended, to the really cool world of ophthalmology so you can improve your vision and your eye health. My channel offers practical, useful tips for daily life, as well as fun behind-the-scenes views of my job and the really cool world of eyes. If you find any of this helpful, please go ahead and like the video and subscribe to the channel for more. In this video, I'm going to share my story about the treatments that I've tried and the one that ultimately ended up working for me. This video isn't going to be a comprehensive review of all the possible dry eye treatments that are out there, but for a future video, if that kind of extensive educational content is something that you're interested in, please do let me know so I can make a future video on it. This video in particular is going to be about my journey and the medications that I have tried, and we'll be honing in on the one that ended up being the golden ticket treatment for me. First, we have to get into a little bit of my personal ocular history. I developed nearsightedness around the 4th grade, and I needed to wear glasses. I was pretty non-functional without my glasses, but I really hated how they felt and how they would slip down my nose all the time. Glasses weren't in style at that time. I started to wear contacts in high school, and as expected for a teenager, I didn't quite follow proper contact lens practices. At baseline, contacts worsen dry eye and come with a whole host of other risks, like corneal abrasions, other kinds of eye injuries, and really bad infections. I overwore my contact lenses and essentially burnt my eyes out. I wore them for about 16 plus hours straight every day, which is way too long to be in contact lenses. And I got to the point where I really couldn't stand being in contact lenses for more than a couple of hours. My eyes would get so bloodshot, my vision would be fluctuating and blurry, and basically I had significant contact lens overwear and the accompanying dry eye syndrome. Since I had made my eyes so intolerant to contact lenses, I switched back to glasses until I eventually had LASIK a few years ago. Now come the comments, but Dr. Lee, if you already had so bad dry eye, why did you do LASIK? Isn't that like a death sentence for your corneas? So it's not like I went straight from having significant dry eye straight to going under the knife or the laser with LASIK. I dutifully stayed out of my contacts for a long time and even pre-treated my eyes with amniotic membrane treatments, which really significantly speed up the healing process of dry eye, and I did all of that before undergoing LASIK. Prior to LASIK, my corneas were actually in pretty good shape. However, basically everybody has some degree of worsening of dry eye after LASIK in the immediate post-operative healing period, and this is regardless of your baseline level of dry eye from before your surgery. This is transient and it improves over the healing period, but it's still important to treat it appropriately. My dryness did worsen after LASIK from a grade of maybe around 1 to about a 3, but with treatment, I was able to get it back down to a 0 to a 1. Let's dive into what I did to heal my eyes. Everyone starts with artificial tears. They are over the counter, relatively affordable, and super easy to find. When you go to the store, there are about 1,000,001 eye drop brands, and they could be marketed as artificial tears, re-wetting drops, dry eye drops, tear drops, whatever you want to call them. My rule of thumb is to stay away from eye drops that market redness relief or get the red out eye drops. You know the brands I'm talking about. And avoid any drops that have an active ingredient called nefazoline or tetrahydrozoline. These ingredients are vasoconstrictors and work to whiten your eyes by constricting the small blood vessels that live on the whites of your eyes. However, as the medication wears off, you may experience worsening redness, which can be called rebound redness, or even persistent redness that makes it seem like your eyes are a little dependent on the medication. People who have been using these kinds of get the red out eye drops for a prolonged period of time may feel like no matter what they do, if they don't use the eye drop, then their eyes are always red, and it takes a long time to get your eyes out of that vicious cycle. An article published by the American Academy of Ophthalmology recommends treating these redness relief eye drops similar to nasal decongestant medications. They're not evil, but they should be used judiciously. This article states that these medications should be used sparingly, for example, before a party or a wedding or any other special event, and they shouldn't be used again within a 72-hour period. Other than avoiding redness relief medications, another thing to look for in over-the-counter artificial tears is go for preservative-free. Many people have an allergic reaction to certain preservatives, specifically BAK, which stands for benzalkonium chloride. Even the brands that don't use BAK can still have preservatives that can irritate your eyes with prolonged use. So it's safest to go for preservative-free, especially if you have sensitive or reactive eyes. Keep in mind that preservative-containing eye drops and artificial tears should be used up to a maximum of 4 times daily, but preservative-free eye drops can really be used without an upper limit. The other thing you'll notice is that everybody's eyes are different, and everybody's eyes react to or respond to different brands of artificial tears, even if they're over the counter. My eyes prefer something different from my coworkers, from my patients, and from my family members. Just try a few different ones to see which one your eyes respond to the best. Again, if you think a separate video with a deeper dive into dry eye treatments would be helpful, please let me know in the comments below. Artificial tears are great, but for some people, the over-the-counter stuff is just not enough to alleviate all of their symptoms. People who have a long history of dry eye, diabetes, contact lens wear, ocular surgery, or specifically LASIK or other corneal issues are at a much higher risk for having more significant dry eye that might need a little bit stronger medication than what over-the-counter artificial tears can provide. Okay, let's dive into the first prescription-grade dry eye drop that most people try, Restasis. Restasis is the brand name for cyclosporin 0.05%. Restasis was first approved by the FDA in 2003 and has been a first-line prescription-grade dry eye treatment for a while. Restasis's formula is preservative-free whether you get the multi-dose vial or the single-use containers. The active ingredient, cyclosporin, works to increase your natural tear production by decreasing the inflammation that can cause dysfunction of your lacrimal gland. You have a lacrimal gland up here, and they both work to create tears that wash over your eyes. How does cyclosporin work? Cyclosporin works to block inactive T cells. Now, what are T cells? T cells are immune cells that are part of your immune system, and your immune system is responsible for the inflammatory response that ultimately causes your dry eye symptoms of pain, redness, swelling, and irritation. A T cell is an immune cell that, when activated, can cause that inflammatory cascade. Your body has some inactive T cells, which Restasis can work against, but you also have activated T cells that were already activated from a prior date that are swimming around in your bloodstream and can still contribute to inflammation and dry eye. These already activated T cells will have a lifespan of up to about 6 months, and this is why medications like Restasis that work on inactive T cells can take up to 3 to 6 months of twice daily use before you see a full effect of the medication. This is because your Restasis medication is not really working on those already activated T cells from before. And so you kind of have to wait for the life cycle to finish itself before it can work on the inactivated T cells. This is why it's so important that when starting a medication like Restasis, it's really important to use it very diligently. You use it twice a day, 1 drop in the morning in each eyes and at night in each eye. And you have to do this consistently for several months before you can call it a fair trial of the medication. If you stop it too early, we would never know if the medication would have been a good medication for you or not. Just like most patients, I tried Restasis as my first prescription-grade dry eye treatment. I did experience a bit of burning with installation of the eye drop, but it really wasn't bad. The main reason why I stopped Restasis and tried something new is because even with several months of continued diligent use, I didn't really have a huge impact on my dry eye symptoms. We'll go over all of the other medications that I have tried subsequently. A good thing to note is that Restasis, since it's been out since 2003, now has a generic cyclosporin alternative, and that's been available since 2022. Another medication that I tried on my personal dry eye treatment journey is Xiidra. Xiidra is the brand name for lifitegrast 5%. Xiidra is a newer medication than Restasis, having achieved its FDA approval in 2016. Like the cyclosporin, which is the active ingredient in Restasis, lifitegrast also works to inhibit T cells. But the differentiating factor for lifitegrast is that it can work on both inactivated T cells and activated T cells. For this reason, you don't have to wait the whole 6-month life cycle for a given T cell before you start to experience relief in your dry eye symptoms. Xiidra is said to start working, not a full effect, but to start working for some patients in as little as 2 weeks. My personal experience with Xiidra was interesting. I had stinging, burning, and irritation for about 5 to 10 minutes after putting the drop in, but the main kicker was I had a lot of tearing and mucus production, kind of goopy tears for about 20 to 30 minutes after each drop use. And this really affected how I was able to function for those 20 to 30 minutes every morning and every evening. Like if I needed to get in my car and drive to work immediately after putting the drops in, it was pretty significant of an impact. Needless to say, I didn't love those symptoms, but the other side of the story is my dry eye was gone. My eyes felt great during the daytime, and I didn't even need to use artificial tears. In the end, like any normal human being, I didn't want to deal with the headache of that 20 to 30 minutes of symptoms after each eye drop. But each time I tried to discontinue my use of Xiidra, my dry eye symptoms would come back. And then each time I resumed the Xiidra, after the 2-week period of waiting for that medication to kick in again, my dry eye would go away. I felt resigned to just deal with the 20 minutes of irritation and annoyance after each use every day, but eventually, every time I put the medicine in, my symptoms got worse. Every time I put a drop of Xiidra in, I would get some redness, burning, stinging, and then even some eye and eyelid swelling that would last longer and longer and longer with continued use. I think I was developing a sensitivity to something in the Xiidra medication, and eventually I just had to cut it out completely. It just goes to show that what might work for your eyes at one point in time might need to change in the future, and we're really lucky that we have lots of different medications to try out. In the end, I'm actually glad that this happened to me because it caused me to look for another medication, and I found something that works just as well for me without the 20 minutes of headache. We'll get to that medication last. In the middle of my time using Xiidra, a shiny new medication for dry eye became available. Miebo was FDA approved in 2023, and it was purported to be the next best thing in dry eye treatment. Miebo is an interesting product in that it only has one ingredient, perfluorohexyloctane, a semi-fluorinated alkane molecule. Miebo targets tear evaporation rather than trying to improve your natural tear production. It aims to try to make your tears last longer on the surface of the eye before dissipating. Per their website, The exact method that Miebo works is unknown, but it aims to create a protective layer on the surface of your tear film and your cornea to help prevent your tears from evaporating. I did try Miebo, but at that time, I was also using Xiidra, and it wasn't a very good experiment because there were too many factors with multiple medications going on. But I have had a lot of patients who start Miebo and have significant relief of their symptoms. It's important to know which kind of dry eye you are suffering from. There is evaporative dry eye, where you make tears, but the tears are unhealthy, and so they evaporate too quickly off of the surface of your eye. And there's also aqueous tear deficiency dry eye, where you're just plain old not making enough tears. There are medications that can treat both, but the most effective and practical way to treat your specific dry eye is to ask your doctor which kind of dry eye you have, because the treatments are a little different. There's a second dry eye treatment that also got FDA approved in May of 2023, and that medication is Vevye. Vevye, another cyclosporin eye drop alternative that came out to compete with Restasis, came onto the scene boasting that it could deliver about 22 times more cyclosporin onto your cornea compared to Restasis. What makes Vevye different? It has a water-free, preservative-free base of perfluorobutylpentane. Does that sound a little familiar? If it does, it's because it sounds a little bit like the chemical composition of Miebo, right? Perfluorobutylpentane is actually a semifluorinated alkane, just like Miebo. Except the creators of Vevye figured out how to dissolve cyclosporin 0.1% into that base. I think of it kind of like the cyclosporin active ingredient from Restasis mixed with the semifluorinated alkane water-free base of Miebo, combined together to become this amazing hybrid product. I think Vevye is reported to deliver more of that cyclosporin active ingredient into your cornea compared to good old Restasis because of Vevye's water-free semifluorinated alkane base that lasts longer on the cornea compared to a water-based eye drop like Restasis. A big thing to take note of is that with Restasis, a lot of my patients report burning and stinging with use of the medication. But in the clinical trials for Vevye, 99.8% of patients developed no or very mild stinging or burning. I experienced this benefit myself as well. I noticed that you really barely feel the drop going in. Probably because without water in the formula, you don't really feel the weight of the drop hitting your cornea, nor do you feel that splash sensation. The drop that comes out of the Vevye bottle is quite small, and if you miss your eye and you get that drip down your cheek, you'll notice that it's a little bit more of like a thin, oily consistency rather than a watery drop. I had minimal burning sensation with Vevye, and I really only felt anything at all on the days that I already knew my eyes were super dry and a little bit more sensitive than usual. I was really happy with it. Vevye didn't burn like Restasis, and it didn't blur me and cause me to have goopy tears for 20 to 30 minutes like Xiidra did. And most importantly, Vevye has really been working for me. My symptoms of burning irritation, you know that burn that gets worse when you close your eyes, and the redness and the foggy vision and the sensitivity have significantly improved. And even when I got my own eye exam, my quantitative score of dry eye has almost gone completely to 0. I think I've found my holy grail dry eye drop, at least for now. There are always new and exciting treatment modalities coming out, especially for something as wide-sweeping as dry eye. We'll see if something even better makes it to market soon. So that was my personal story of dry eye, my nearsightedness, contact lens overwear, how I got LASIK, had dry eye after LASIK, and all the different things that I've tried since then to help improve my dry eye. Keep in mind, this is my personal story and my personal eyes, and my eyes may be different from your eyes, okay? So everybody's eyes respond a little differently to different medications, right? So what worked for me or what didn't work for me might not be the same story for yourself. Also, keep in mind that dry eye treatment is not all eye drops, not even by a long shot. I treat dry eye patients every day, and we discuss the treatment options thoroughly, whether they are over-the-counter eye drops, prescription eye drops, punctal occlusion, amniotic membrane grafts, and other more intensive treatments, because they are all good options. If this sounds interesting and you want to learn more about it in a future video, please do let me know in the comments so I can make what you want to watch. Thanks.